Attention deficit hyperactivity disorder is also known as ADHD. It is the most common neurodevelopment disorders of childhood. It is usually first diagnosed in childhood and often lasts until adulthood. Children with ADHD may have trouble paying attention and controlling impulsive behaviors. For example, the child may act without thinking about what the result will be or be overly active. It is completely normal for a child with ADHD to have trouble focusing and behaving. However, children with ADHD do not just grow out of it. The symptoms continue. These symptoms can be severe, causing a child to struggle at home and school. A child with ADHD may daydream often, forget easily, and fidget with their hands. Also, it is common for a child with ADHD to talk often and make careless mistakes or take unnecessary risks. Sadly, it can be hard for them to play with other children. For instance, it is more likely for them to have trouble taking turns than a child without ADHD. There are two types of ADHD. The first type of ADHD an individual can have is predominantly attentive presentation. It is defined as a type of ADHD when an individual struggles to organize or finish a task. This person is easily distracted or forgets the details of daily routines. The second type of ADHD is predominantly hyperactive impulsive presentation. If a person has predominantly hyperactive impulsive presentation, they often fidget and talk a lot. Also, it is hard for them to stay still for a long period of time. They may interrupt others, grab things from people, or speak at inappropriate times. It is hard for this person to wait their turn or listen to directions. Additionally, an individual can have both types of ADHD. If this is the case, the individual has combined presentation ADHD, meaning they have an equal amount of predominantly attentive presentation and predominantly hyperactive impulsive presentation. Scientists are studying causes and risk factors in an effort to find better ways to reduce the chances of a person having ADHD. The causes and risk factors are unknown, but current research has shown that genetics play a huge role. Deciding if a child has ADHD is a process with several steps. There is no single test to diagnose ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from parents and teachers. In most cases, ADHD is best treated with a combination of behavioral therapy and medication. For preschool age children with ADHD, behavioral therapy is recommended as the first line of treatment before medication is tried. But what works best depends on the particular child and family. Good treatment plans for parents include close monitoring, follow-up appointments at the doctor, and making changes to medication if needed. Adderall is the prescription medication used to treat ADHD. Taking Adderall helps increase the ability to pay attention, focus, and control behavior. It is available as a tablet and comes in different doses. The dose ranges from 5 milligrams to 30 milligrams. The prescribed dose will depend on the size of the patient and the severity of symptoms. Doctors typically start on a low dosage and gradually increase the dose if needed. The tablet is usually taken 2 to 3 times daily. Some side effects of taking Adderall include loss of appetite, nervousness, stomach pain, restlessness, headaches, vomiting, and diarrhea. ADHD relates to me because my younger brother was diagnosed with ADHD a few days ago. My mother and his teacher were concerned because he fidgets a lot and has trouble focusing at school. Sometimes his behaviors are impulsive and he does not understand why he misbehaves, especially because my parents have taught him right from wrong. Yesterday was his first day taking Adderall, so my mother and his teacher are closely watching him to see how the medication affects him positively or negatively. After doing further research, I now understand how ADHD affects individuals. especially children. It is heartbreaking to me that my brother may never grow out of having ADHD, but I'm thankful that it's medication such as Adderall that he can take that can help him control his ADHD. Simply, ADHD does not define a person. It is something that affects many people in the world.